Disclaimer: the information provided on this channel is for educational purposes only and should not be considered medical advice. While we make every effort to ensure the accuracy and reliability of the information presented, it is not a substitute for professional medical advice, diagnosis, or treatment. Viewers should always consult with qualified healthcare professionals regarding their specific medical conditions or concerns. By assessing and using the content on this channel, viewers agree to waive any liability against healthcare sphere and its creators for any potential damages or consequences resulting from the use of the information provided. Cervical spondylosis. Cervical spondylosis, also known as cervical osteoarthritis, is a degenerative condition affecting the cervical spine, neck region, characterized by the wear and tear of the vertebrae and discs. Causes: aging, degeneration of the cervical discs and facet joints over time, intervertebral disc degeneration, loss of water content and structural integrity of the discs, herniated discs, protrusion of the disc material into the spinal canal. Number 4. Bone spurs, osteophytes, abnormal bony outgrowths that develop on the vertebral bodies and facet joints. Poor posture, prolonged sitting, computer work, or improper lifting techniques. Previous neck injuries or trauma when untreated. Clinical features: neck pain and stiffness, often worsening with movement, radiating pain to the shoulders, arms, or hands, numbness, tingling, or weakness in the upper extremities, headaches, especially at the base of the skull, and loss of coordination or balance, cervical radiculopathy, that is, compression or irritation of the spinal nerves leading to pain, weakness, or numbness in specific area of the upper body. Example, say for elbow. Pathophysiology. Chronic wear and tear of cervical spine lead to degenerative changes such as disc degeneration, bone spur formation, and thickening of ligaments. These changes can result in compression of spinal cord or nerve roots, causing symptoms. Investigations: X-ray to visualize bony abnormalities such as bone spurs and changes in vertebral alignment. MRI, that is magnetic resonance imaging, provides detailed images of cervical spine, discs, and surrounding soft tissues to evaluate the extent of degenerative changes and identify compression of the neural structures. The next is CT, which is computed tomography scan, helps assess bony abnormalities and spinal canal dimensions. Electromyography EMG and nerve conduction studies to evaluate nerve function and assess for nerve root compression. Management: we do have three methods and more. In this video, we'll discuss about the three. First one is medical management, second one is surgical options, and the last one is physiotherapy management. In medical management, first is to treat the pain. Pain management with NSAIDs, which is non-steroidal anti-inflammatory drugs, muscle relaxants or analgesics. Corticosteroid injections, example epidural steroid injections, to reduce inflammation and elevate pain. Physical therapy to improve the neck muscle strength, flexibility, and posture. Number 2. Surgical options, reserved for severe cases with significant neurological deficits or failed conservative treatment. Decompressive surgery, removal of bone spurs or herniated disc material to relieve pressure on spinal cord or nerve roots. Spinal fusion, stabilization of the affected vertebrae to prevent further degeneration and relieve symptoms. Last but not the least, management is about physiotherapy. ROM, range of motion exercises to improve flexibility and reduce stiffness. Strengthening exercises to stabilize the cervical spine and support proper posture. Manual therapy techniques with support of the healthcare professional, such as mobilization or manipulation to elevate pain and improve joint function. The management approach for cervical spondylosis depends on the severity of symptoms, the presence of neurological deficits, and the individual's overall health status. Treatment should be tailored to address specific symptoms and improve quality of life. Regular follow up with the healthcare professionals is important to monitor progress and adjust the treatment plan as needed.